Nasogastric tube insertion and feeding. Disclaimer: this video is for educational purposes only.
Hello everyone, I am Michelaika Javier, a 4th year nursing student from the University of the Northern Philippines. In this video, I'm going to demonstrate on how to insert a nasogastric tube or NGT for short. I am also going to demonstrate on how to feed the patient using a nasogastric tube. So what is a nasogastric tube? It is a tube that is passed through your nose, down to your nasopharynx, down to your esophagus, and down to your stomach. It is made up of rubber or plastic. It also has a bidirectional function.
For the diagnostic indications, it is used for evaluation of upper gastrointestinal bleeding, aspiration of gastric fluid contents, identification of the esophagus and the stomach on a chest radiograph. For the therapeutic indications, it is used for gastric decompression, including maintenance of a decompressed state after endotracheal intubation, often via the oropharynx. It is also used for administration of medication. It is also used for relief of symptoms and bowel rest in the setting of a small bowel obstruction. And lastly, it is used for feeding. For the absolute contraindications for nasogastric intubation includes the following: severe mid-phase trauma and recent nasal surgery. The main complications of nasogastric tube insertion includes aspiration and tissue trauma. Placement of the catheter can induce gagging or vomiting. Therefore, suction should always be ready to use in case this will happen. For the procedure,
So first things first, we need to verify the doctor's order on the patient's chart to make sure that we will carry out the right order. Second step is to prepare all the equipments needed so that it won't be that time consuming and it will make you work easier.
the materials needed will be nasogastric tube, a septic syringe, lubricant, tape, cup of water, emesis basin, and pH indicator strips.
Provide privacy. Close all the curtains and the doors. By doing this, the patient and the nurse will have effective communication which is needed in the essential care. Perform hand washing. We all know what is the rationale of this procedure, right? It is done to prevent the spread of microorganisms. Introduce yourself to the patient. Good morning, ma'am. I am Michelaika Javier, a 4th year nursing student from the University of the Northern Philippines. I am your nurse for today, ma'am. Identify the patient using 2 identifiers as the patient's name and her birthday. So, may I know what is your name and your birth date, ma'am?
My name is Hannah Beatriz Javier. I was born on December 16.
Explain the procedure to the patient. So, ma'am, this is a procedure where I am going to insert a tube in your nose. It will provide access to the stomach for diagnostic and therapeutic purposes. It may be a little bit uncomfortable, but a lubricant will alleviate the discomfort. Position the patient in an upright position or high fowlers for proper neck and stomach alignment. Don gloves. Examine the nostrils of the patients for any deformities or obstructions to determine the best site of the insertion of the nasogastric tube. Measure the tubing by putting the tip of the nasogastric tube on the tip of your nose, then extend it to your earlobes, then extend it down to the xiphoid process. Mark the measured length with marker or note the distance. Lubricate the tip of the tube 2 to 4 inches with lubricant. Pass the tube via the air posteriorly down to the nasopharynx, then to the esophagus, and to the stomach. Instruct the patient to swallow small sips of water, and by doing this, it may enhance the passage of the tube. When the patient is sipping small sips of water, you can advance the tube.
Ma'am, please swallow small sips of water so that it can enhance the passage of the tube. If resistance is met, rotate tube slowly with downward advancement toward closest ear. Do not force inserting it. Withdraw tube immediately if changes occurs in patient's respiratory status, if tube coils in mouth, if the patient begins to cough or turns pretty colors.
Advance the tube until the mark is reached. Check for the placement of the nasogastric tube by attaching a syringe on the free end of the tube, then aspirate gastric contents. The pH level of the gastric content that was aspirated should be below 6. For better assurance of the placement of the tube, we need to obtain X-ray before instilling any feedings or medications. After that, secure the tube with tape. Document the reason of the tube insertion, the type, and the size that was being used. For the procedure of the nasogastric feeding, first things first, we need to check the schedule of the patient's feeding. Second, prepare the ordered amount of oral food supplement.
Connect the asepto syringe to the feeding port of the NGT. Kink the tube properly to avoid air from entering.
Before starting to feed the patient, we need to instill 30 ml of water to remove any blockage of the tube.
Do not allow the water formula to fall below the bottom of the syringe. because that will carry air and can cause abdominal distension. Slowly let go of the kink and let the gravity carry the water inside of the tube.
Start oral formula feeding. Tell the patient that if she feels like vomiting to tell you immediately. Ma'am, if you feel that you are going to vomit, please tell me immediately so that we can stop it.
Flush the nasogastric tube with 30 ml of water after every feeding.
After the oral formula feeding, close the feeding port by the stopper. Tell the patient that the feeding is done and thank her for her cooperation. Ma'am, we are done already with the feeding. Thank you for your cooperation.
Discard all the soiled materials.
Perform hand washing.
That would be all. Thank you for watching. This is Michelle Javier from BSN 4B.